An abdominal aortic aneurysm, AA, is a condition in which the abdominal aorta, the largest artery in the body, bulges or enlarges. An aneurysm is defined as a dilation of an artery that increases its diameter by at least 50%. An abdominal aortic aneurysm is an enlargement of the aorta. An abdominal aortic aneurysm is often due to the degeneration of the aorta, specifically the media or middle layer of the artery. Risk factors include smoking, peripheral arterial disease, coronary artery disease, hypertension, genetic factors, and chronic obstructive pulmonary disease, COPD. An abdominal aortic aneurysm usually does not cause any symptoms until it expands or rupture. A rupture may cause sudden back, abdominal, or flank pain, a pulsatile abdominal mass, and signs of shock such as clammy skin, syncope, fainting, and palpitations. This is a critical emergency. Treatment options for unruptured aneurysms depend on their size and range from monitoring and medication to surgery. In an open repair of an abdominal aortic aneurysm, AA, the surgeon makes a vertical incision down the middle of the abdomen. To gain access to the aorta, the surgeon will move aside the organs, such as the colon and small intestines. Clamps are placed on the aorta, above and below the aneurysm. Depending on the size and location of the aneurysm, the clamps can be placed on the iliac arteries. This will temporarily stop the blood flow so that the aorta can be opened without bleeding. Once the aorta is clamped, the surgeon makes a vertical incision over the aneurysm and above and below the sac to open the aorta. A graft, or cylinder-like tube, is placed inside the aorta. It is attached with sutures at both ends, connecting it to the healthy parts of the aorta above and below the aneurysm. This creates a stable pathway for blood flow, bypassing the enlarged and weakened area of the artery. After checking that there are no leaks, the aorta is closed over the graft and the clamps are removed. Once the clamps have been removed and normal blood flow has been restored, the surgeon prepares to close. The organs are placed back into their normal position and the incision is closed with sutures or staples.